As Nigeria joins the world to mark the 2025 World Health Day under the theme Healthy Beginnings, Hopeful Futures, health experts have raised the alarm over vaccine shortages that could put millions of lives, especially children, at risk. At a press conference in Abuja, Chairman of the National Health Insurance Authority, Senator Ibrahim Olorimbe, warned that without urgent reforms in vaccine financing and delivery, the country could face setbacks in preventing life-threatening diseases. He called for a reliable vaccine supply chain from procurement to last-mile delivery in rural health centers. Olorimbe stressed the need for sustained investment in cold chain infrastructure to prevent vaccine spoilage and inefficacy, adding that local production of routine vaccines would reduce costs, enhance access, and create jobs.
In our own climate, measles kill much more, but measles don't only kill, measles maim. You see a lot of people where you see their eyes blind, or you see people not hearing and so on, maybe because they suffer measles in childhood. So the why we need to do is that, one, vaccines prevent a lot of diseases, in which case, on the long term, it is cost effective in terms of preventing us from spending much more money to treat and manage those diseases. In which case, if you spend more money on vaccine, not more money, if you spend adequate money on vaccine, we would spend less on treatment. We spend less on managing the consequences of those that are not vaccinated.
The event, organized by the Vaccine Network for Disease Control, aims to spotlight Nigeria's ongoing challenges in immunization coverage. Meanwhile, the network CEO Chika Ofo highlighted the funding gaps that continue to threaten progress made in 2024, stressing that over-reliance on donor support is unsustainable. She reiterated the need for actionable financing policies that prioritize access to hard-to-reach areas, calling for a more predictable national budget for vaccines, timely disbursement of funds, and stronger partnerships with state and local governments.
Urge that President Bola Ahmed Tinubu to direct the Ministry of Budget and National Planning to establish a predictable and sustainable immunization financing framework. Currently, vaccine funds are part of the service-wide votes, making disbursement uncertain. Immunization is not just a health priority, it is a smart economic investment that saves lives and reduces healthcare costs. The National Assembly to support the inclusion of vaccine financing as a first-line charge in the annual budget. This will ensure timely and predictable funding for immunization. The state and local government to allocate dedicated vaccine funding, ensure timely budget releases, and establish accountability mechanisms to ensure effective resource utilization.
It's very clear that if we do not chart a pathway for sustainable immunization financing in Nigeria, we are going to be having really terrible health outcomes.
These experts urged the private sector to step up in supporting vaccine logistics and delivery. With millions of children depending on routine immunization, health advocates say Nigeria cannot afford to delay. The country's future, they insist, begins with protecting its youngest citizens. Vincent Okushi, QTV News, Nigeria.